What are polycystic ovaries and PCOS? Have you ever wondered what polycystic ovaries are and how they relate to a condition called Polycystic Ovary Syndrome? Let's dive into this topic, which is important for understanding fertility and overall health. Polycystic ovaries are characterized by the presence of multiple small fluid-filled sacs, known as follicles or cysts. These cysts are immature follicles that haven't developed properly to release an egg during ovulation. It's important to note that having polycystic ovaries does not automatically mean a woman has a medical condition. However, they are often part of a broader syndrome known as Polycystic Ovary Syndrome, commonly referred to as PCOS. PCOS is a hormonal disorder that affects about 5 to 10% of women of reproductive age. It is marked by a mix of symptoms caused by hormonal imbalances. These can include irregular or absent menstrual periods, elevated levels of male hormones called androgens, and the presence of polycystic ovaries visible on an ultrasound scan. This syndrome can lead to various symptoms and health issues, particularly regarding fertility and metabolism. Key features of PCOS include irregular menstrual cycles. Women with this condition often experience infrequent or prolonged periods due to irregular ovulation or a complete lack of ovulation. Another significant aspect is excess androgen levels. Elevated male hormones can lead to symptoms like excessive hair growth on the face, chest, or body, acne, oily skin, and thinning hair on the scalp. When examined through ultrasound, polycystic ovaries may appear enlarged with many small immature follicles arranged around the edge, sometimes described as having a string of pearls appearance. One of the most concerning aspects of PCOS is its impact on fertility. Because ovulation can be irregular or absent, PCOS is one of the leading causes of female infertility. Many women with this condition find it challenging to conceive, but with appropriate medical treatment, many can achieve pregnancy. PCOS is also associated with metabolic issues, particularly insulin resistance. This can increase the risk of developing prediabetes and type 2 diabetes. Additionally, women with PCOS may face a higher risk of cardiovascular problems, such as high blood pressure and abnormal cholesterol levels. Other symptoms may include weight gain or difficulty losing weight, patches of darkened skin, sleep apnea, and mood disorders like depression and anxiety. From a fertility and endometriosis perspective, PCOS is significant because it directly affects ovulation, making conception more challenging. Unlike endometriosis, which involves the growth of uterine-like tissue outside the uterus and can cause pain, PCOS primarily disrupts hormonal balance and ovulation. However, it is possible for both conditions to coexist, which can further complicate fertility issues. Management of PCOS focuses on addressing symptoms and improving fertility and metabolic health. This may involve lifestyle changes, such as diet and exercise, to enhance insulin sensitivity and manage weight. Medical treatments can include hormonal contraceptives to regulate menstrual cycles, medications to induce ovulation for those seeking to conceive, and treatments for excess hair growth or acne. In summary, polycystic ovaries refer to the appearance of multiple small cysts on the ovaries, while polycystic ovary syndrome is a broader hormonal disorder characterized by irregular periods, excess androgens, and polycystic ovaries. Understanding this distinction is crucial for accurate diagnosis and effective management, especially in the context of fertility and related conditions like endometriosis. If you suspect you may have PCOS or are experiencing related symptoms, it is essential to consult a healthcare professional for personalized advice and treatment options.